cannot just keep throwing pharmaceuticals for long term and think that's the solution. Like, people are not getting better. It's just a Band-Aid approach. So in history, physicians were encouraged, and maybe not even encouraged, just naturally scientists at the same time. And most of us that go into medicine and become physicians, we have a scientist's mind. You know, my undergraduate degree is in chemistry. Even if you didn't major in biology or biochem or chemistry, you still had to take all the prereqs, all the core classes to get into medical school. And then obviously medicine is science, you know, it's an art as well. And that's what drew me to medicine. I believe that the combination of science and art. But basically nowadays, physicians in conventional medicine were basically taught to just follow the rules. If it's not in the guidelines, if it's not in a huge randomized, double-blind, placebo-controlled trial, you cannot recommend this treatment to anybody, or you risking your license, or you're not, you know, doing what you're told. But in history, if you go back and learn about some of the best physicians in our history, they were experimenting. They were using their science minds. They weren't okay with the status quo when they knew something wasn't discovered yet, or there wasn't a solution to a problem they were seeing with their patients or their friends and loved ones. They would experiment on themselves. They would experiment on their families. And then once they realize, okay, this works, this is safe, like, let's get this going on a bigger scale, they would, you know, spread the knowledge and lead to more research. My point is, right now, what I feel like is going on is, in this country, physicians are still who we seek out first and who we respect the most, right, for medical advice and treatment. And what's happening, though, is we are only so far along in our medical research, and there are so many chronic illnesses that we are not treating correctly. We cannot just keep throwing pharmaceuticals for long term and think that's the solution. People are not getting better. It's just a Band-Aid approach. So I believe pharmaceuticals are life-saving. They can be life-saving. They can be used as a bridge, but it's not treating, in most situations, the root cause of what the problem is in the first place. So yeah, maybe we use the pharmaceutical when someone's in a bad place and quality of life is affected, or their life is on the line. Yes, there's a need and there's a use for them, but we are not treating the root cause. And everyone's excuse or reason is, well, where's the data? Where's the research? Like, anything I post in a physician online forum, they're like, where's the data on that? I'm like, okay, sometimes we need to think outside the box and see what is working. For example, there's no reason that we, for like a mild infection, need to jump to an antibiotic when there's beautiful antibacterial herbs that work with our body. The bugs don't build resistance to them. We don't get all the side effects. Like, why don't we try them first? Unless it's in like more of a, you know, septic or emergency situation, we go right to antibiotics. But like, kids, a little ear infection, or, you know, like, why don't we give them, or strep throat, like, why don't we give them the antibacterial herbs that our body is okay with and it works with our body? And there's no data because no one can make any fucking money from it. Like, who's gonna pay for the study? It's all big pharma, and like, you know, sometimes insurance companies fund these studies, but like, you have to look at who's paying for the studies and think about why there's not studies on herbs and natural supplements. It's because nobody can profit off of them. So thank God we are living in a time where we are starting to wake up and remember these practices that were around forever. And, you know, there are some supplement companies that are great and clean and trustworthy. And we can start to remember basically anything we need to treat our body can come from the earth. We don't have to man-make things. We don't have to man-make things in a lab. Doctors aren't being scientists. Doctors are being little minions on the front line, just doing what we're told, changing our practices when the guidelines change. And like, that doesn't take much thought. that doesn't take much like open-mindedness and thinking outside of the box. It does take listening, right? Like we still have to be good listeners even if we're following the guidelines. Physicians need to wake up a little bit and realize that the systems in which we are trained and in which we are working are failing us and the general public. You see your patients say, do I have to be on this Synthroid, which is for hypothyroidism? Do I have to be on this forever? And when you find yourself saying, yeah, maybe, does that feel right? Does that feel right? Or can our science mind turn on and be like, I wonder how we can treat the root cause of why their thyroid is underactive in the first place and maybe get them off of these chronic pharmaceuticals. And that goes with like so many chronic conditions. That's just one example. So I'll tell you, like, I experimented on myself first. I lived through my own healing journey. That's what really sparked a lot of my path down this road of how I practice now. I treat my family outside of the box. I am now bringing in a combination of evidence-based medicine, the evidence we do have to date, and practice-based medicine, meaning a lot of the training I got in my functional medicine courses, what we know so far, the emerging research on a lot of the natural healing remedies, and then just like ancient wisdom that I'm like slowly freaking remembering. Doctors, healers, everyone, let's not take everything as is and let's use an open mind. Let's start with a hypothesis and figure out how we can help people, because that's what we signed up for, to be the light in people's dark times in their health. So I'm sending you all love. I got a little fiery about this topic. I'm also writing my first Substack article about this, so keep a lookout for that. Sending you all so much love, open-mindedness, and healing.